Statistical significant measure mathematically using p-values. Conventional a value lower than the alpha significant level of 0.0 or 0.05 is considered statistically significant, and known hypothesis can be restricted clinically significance measure using numbers needed to treat. And then T signifies the total number of the patient needed to treat the other one patient to cure from the disease. Consider P's. NNTs of 1 is the best. Only considered if P is smaller lower 0.05. Convenient sampling. The study population is choosing from the group that it is easy to reach or access. Incomplete data, differing rates of responses from the relative groups. Hawthorne affects the participants perform differently in the study than if they were not in the study. The question of the mean values of the be extremely high or low to begin, but over time they will regress to average level. Placebo effect in tendency for people respond favorably knowing they are receiving treatment. Publication bias when the outcome of the study bias whether or not to publish the study. Single group study a group in patient with the disease and compares them to historical control group. Case study is a single person group or situation involving the right condition. Cross-sectional survey, a study of random sample cross-section in time from a target population, easy to administer, cannot prove the cause-effect relationship. Measure prevalence. Case control study a random sample selected based on the presence or absence of disease. Samples were placed into either case group people who had an exposure or the control group before people who did not have exposure. Individuals are observed to see the predicted outcome occurs. Measured using odds ratios. This study is most impacted by record bias. Change in the rates of participants in the study are able to record report information. God studies a random sample for healthy and risk population and follows them over time. Identifies new event of disease, measure incidence, measure use relative risk. Prospective cohorts follows individual over time. Retrospective cohorts collect information about individual past. Non-randomized clinical trials studies non-random sample groups. Samples are placed into either one of two control groups or one of two different treatment groups. Randomized control trial studies to randomly assigned sample groups. Samples are placed into either a treatment intervention of control group. Systematic meta-analysis studies results from two or more published studies to create a meta-analysis. A systemic review collects and summarizes data that fits into a specific category. A meta-analysis uses statistical methods to analyze the results of the gathered studies. Hierarchy of the scientific evidence.